아. 안녕하십니까. 아직 그 뒤에 몇 분들이 그 발열 체크로 시간이 다소 소요될 것 같습니다. 정확하게 11시에 저희들이 진행을 하도록 하겠습니다. 네. 자, 이제 심포지엄을 곧 시작하도록 하겠습니다. 착석해 주시면 감사하겠습니다. Good morning. I am Dr. Kyung-Yong Kim, Director of International Relations Office at Daegu Health College. As a coordinator of the 5th Allied Health Sciences International Symposium, I'm very pleased to announce its opening in time for Daegu Health College's 50th anniversary. Today, we are meeting in a virtual posture in light of the COVID-19 pandemic we face as a global community. I believe many colleagues and students abroad in the fields of medical technology, physical therapy, occupational therapy, speech therapy, and nursing are watching us this live streaming video. And I welcome all of you. Dating back to 2010, the initial talk about a tripartite medical technology symposium with Kumamoto Health Science University, Japan, Central Escolar University, Philippines, and Daegu Health College, Korea, was brought up, and the idea was supported by the presidents of the three institutions. Accordingly, July 25, 2011, the first International Medical Technology Symposium was held with these three institutions at Daegu Health College. The symposium was principally designed to strengthen research and knowledge production by sharing the current major issues of clinical laboratory science and providing an invaluable opportunity for networking and fruitful contacts between our three universities. Our beginnings seem to be humble, but I believe it opened academic connections with all of the participants, created new opportunities for development among us, and enhanced our levels of cooperation. I'm very proud to say now 4 more healthcare programs and 4 more higher education institutions joined this symposium with great interest. I remember when Konkan University Thailand in 2019 hosted the 4th Allied Health Sciences Symposium, we were all excited to meet in Korea for the next symposium. But we never expected the COVID-19 coming. And we never thought that traveling would not be possible. Although I feel sad that we could not meet in person, I'm glad that we could manage to hold this symposium online despite the pandemic barrier. I hope this symposium will bear productive results and highlight a possible avenue for our further collaborations in allied health sciences. Thank you again for your participation. Now, I'd like to invite Dr. Seong-hee Nam, President of Daegu Health College, for a welcome speech. Let's give a big round of applause for her.
Dear distinguished moderators, presenters, and attendees, it is a great moment to extend my warm wishes on behalf of Daegu Health College. Welcome to the 5th Allied Health Science International Symposium on Zoom. To begin with, I would like to express my appreciation to all of you who sincerely committed to this event to make it a success. This event would not been possible without the support of each and everyone present here, especially Dr. Peter Rowell, President of AUAP, and Dr. Parma, Secretary General of AUAP. President Motohiro Takeya from Kumamoto Health and Science University, Japan, Dr. Carito Bormido from Central Escola University, Philippines, Dr. Atawut Chai-Bunruang from Konkan University, Thailand, Dr. Magdalena Natividad, Far Eastern University, Nicanor Reyes Medical Foundation, Philippines, Dr. Maribeth Buengbie from LASIUM of the Philippines University, Batangas. Yes, we all experience an unprecedented situation with the global COVID-19 pandemic, which has put the world on pause and limited our traveling in person. It has put into question how and where to go from here in spite of the vaccine update. Everybody grapples with the immediate needs of the public health crisis. At this juncture, I believe it is meaningful to hold a first online symposium to share such information and the knowledge that we need to know in such a crisis in the allied health sciences, medical technology, physical therapy, occupational therapy, speech therapy, and nursing. We already learned that common sense public health measures, such as the wearing of masks, social distancing, hand washing, do help stop the spread and mitigate community outbreak. Throughout this symposium, I hope we can also learn about some of the challenges that you face in your country, about the profound nature and importance of health science, the data as we search for answers. As we learn, I think we discover more answers as healthcare professionals. Daegu Health College has developed a remarkable reputation for the quality of education since 1971, and we are now celebrating its 5th anniversary this year. The ISO 9001 Quality System Certified DHCEs learn based on the demands of students, advanced for tomorrow, and service our community. To be responsible for our students' better educational environment and their brighter future, the HCC advocates a green and clean campus and offers an excellent faculty and state-of-the-art facilities guaranteeing professional jobs. Daegu Health College has been playing a leading role in exploring allied health science disciplines through effective coursework, which serves as a comprehensive and well-rounded education and better prepares students for employment in the health field. The integrated allied health sciences education that we initiated respond to the needs of the increasingly complex state of the healthcare system by providing opportunities for students to acquire vital knowledges and skills, and we will critical in practicing and navigating a different healthcare system from their fields. The core curriculum is designed to expose students to the theoretical underpinnings of the broad, interdisciplinary sciences that inform the public health and medical fields. Additionally, students will gain knowledge and experiential exposure to best practices in interprofessional collaboration, decision-making, and clinical relationships with a special emphasis on cultural competence and sensitivity to the underprivileged. I believe that it is important to share knowledge with colleagues. It can foster vision in others and strengthen professional ties. When you share with others, it helps deepen your own knowledges and innovates what you know. Sharing your knowledge and with colleagues is a great service, and it gives you an opportunity to think about others and not just yourself. In this sense, I ensure the symposium will be profitable and fruitful for everyone present here. Thank you very much.
Thank you, Dr. Nam, for her warm welcome. Shall we give her another round of applause, please? Next, I'm very honored to invite a special guest who will give a congratulatory speech for us. He is the president of AUAP, Association of Universities of Asia and the Pacific, and also president of Lyceum of the Philippines University, not only in Batangas, but also Laguna and Davao campus. He pre-recorded a video due to the limit of traveling. So let's give a warm welcome to Peter Lowell.
Good day, everyone. On behalf of the Association of University of the Asia-Pacific region, I would like to greet Daegu Health College, particularly Dr. Nam and Dr. Kim. Dr. Nam has been president of the Association of Universities in the Asia-Pacific region, and I'm now its current president. And on behalf of AUAP, I would like to congratulate Dr. Nam on her stewardship of AUAP over the past 2 years. Today's occasion marks another important milestone in the history of Daegu Health College. Today, they are sponsoring and hosting an Allied and Sciences Symposium to bring out best practices, latest research findings, and to push the frontier of knowledge. I know that Dr. Nam has done a great deal for Korean higher education, together with the many partners that Daegu Health College has all over the world. On behalf of the AUAP, I would also like to greet our fellow members of AUAP who have joined today. I wish the occasion a great deal of success and look forward to working with all of you. Again, congratulations to Dr. Nam, Dr. Kim, and the entire managerial corps of Daegu Health Colleges, their faculty, and their students. Mabuhay, and thank you very much.
Thank you, Dr. Peter Lowell. Although he is not here, I really appreciate his support for Daegu Health College and this symposium. In order to celebrate the opening of the 5th symposium, as well as DHCC's 5th anniversary, a vocal choir, Fedora Soloist Ensemble, is here for pleasing to the ear. They are quite well-known singers in Korea, and I understand that Fedora means a gift in Greece. So they are going to give us a music gift, and I hope you all enjoy it. Okay, let's welcome Fedora Soloist Ensemble.
l'accento e il pensiero, sempre un amabile leggiadro viso, impianto il ligio e menzognero. La donna ai mocchi, quagliuma e vento, muta d'accento e di pensier. E di pensier. E di pensier. È sempre misero chi a lei s'affida, chi ne confida, mai cauto il cuore, pur mai non sentisi felice a pieno, chi su che seno non mi amore. La donna ai mocchi, quagliuma e vento, muta d'accento e di pensier. E di pensier. E di pensier. Nessun dorma, nessun dorma. Tu pure, o principessa, nella tua fredda stanza, guardi le stelle che tremano d'amore e di speranza. Sulla tua bocca la dirò quando la luce splenderà. Ed il mio bacio scioglierò in silenzio che ti fa mia.
Thank you. Thank you very much. They are really great with really pleasing and delightful songs. I think this music flew throughout the whole world to cope this pandemic. I hope so. All right, now it's time for the keynote speech. It is my pleasure to introduce our keynote speaker, Jung-Suk Park. She is a Dean of Nursing College at Keimyung University and had a PhD in Yonsei University. She is currently president of Korean Oncology Nursing Society, advisory member of Korean National Cancer Management Committee, and chief in accreditation team, Korean Accreditation Board of Nursing Education. She earned Minister of Health and Welfare citation in 2011 and 2014. Korean Nurses Association Academic Excellence Award in 2016, and even Daegu Mayor citation in 2017 and 2018 twice. As a very experienced nurse and professor, she is going to talk on the face of COVID-19 and the role of health professionals. Ladies and gentlemen, I'd like to extend a warm welcome to her.
Good morning, ladies and gentlemen. It is my great honor to give a keynote speech at the wonderful, this 5th Allied Health Science International Symposium. I would like to thank you, President Seung-hee Nam, for inviting me. The topic I'm going to discuss today is face of COVID-19 and the role of health professionals. As you can see in the table of contents, we will have a look at the brief history of COVID-19 pandemic and its symptoms. And we will also review the role of health professionals in the face of prevention, screening, treatment, follow-up, and end of life, I classified. 2020 was a very particular year in the human history. The whole world has stopped. We couldn't hold other people's hand anymore. Spending more than 1 year in such a state has brought about many changes in individual, families, workplace, society, country, and the world. My favorite TV show, Miss Trot. Do you know Miss Trot? Yes. Miss Trot was actually filmed without audience, but surrounded by online viewers from around the world, which gave me more excitement and joy. These changes will continue until COVID-19 comes to an end. We will never be able to go back to the life before COVID-19. Let's look at a brief history of the COVID-19 pandemic in Daegu, Korea, and the world. Daegu, where we are currently holding this conference, is a city hit hard by COVID-19, and citizens have teamed up to overcome mass infection successfully in 2 months. On February 18, 2020, the first patient confirmed in Daegu, also known as the patient number 31. She was a super spread. From February 19, the number of patients increased sharply. On February 21st, 2 hospitals were designated to solely deal with the infectious disease. One of them, Keimyung University Daegu-Dongsan Hospital, as an affiliated to the university where I work. I'm very proud of that. On February 29th, 741 COVID-19 cases were reported, reaching its peak. From February 18 to April 10th, a total of 6,807 COVID-19 patients were confirmed in Daegu area. In a paper published in the International Academic Journal, Virology Current Research in April 2020, it was argued that we should pay attention to the 40-degree north latitude region, as the number of the COVID-19 infection were high in Italy, Korea, and Iran. The Korea is very notorious at that time. The first medical personnel who entered the world of COVID-19 patients in Daegu-Dongsan Hospital were one experienced head nurse and one internal medicine infectious disease specialist doctor. She is the head nurse, the first woman to come to the patient. They bravely entered the patient room to fight an unknown novel infectious disease. Some personnel left the hospital in fear of COVID-19. So the remaining nurses had to take over everything. That's a very hard job. AFP reporter Ed Jones interviewed a nurse at Daegu-Dongsan Hospital and said the Korean nurses' bandage have become badge of honor. You might think that the nurse put Band-Aid on their faces because they got wounded. No. In fact, it was a wise choice to prevent the goggle and face shield to leave deep pressure on here in faces, to take over, leave press mark and hurt their faces. It's prevention. They chose the Band-Aid. During the first wave of the pandemic in February and March, Korean government did not order an official lockdown of Daegu. Instead, Daegu citizens went into high level of self-quarantine to cope with the infectious disease. Parents in Daegu told their children living other cities, never come to Daegu, and I want to go anywhere. Such effort contributed in blocking further spreading of COVID-19. With the end of the first wave, the director of the nursing department at Daegu-Dongsan Hospital won a proportional seat at the National Assembly and is currently working on legislative activities in relation to the infectious disease and promoting public health. Also, Daegu citizens are said to have protected the city by becoming the strongest vaccine themselves, ourselves. Next, let's have a look at the current situation of the COVID-19 pandemic in Korea. The first wave took place in February and March, and the second wave in August and September, third wave in December, and this year, January, and continued on. Korea shows its first confirmed COVID-19 cases in January 20th, 2020. The Korean government has installed COVID-19 screening station at public health center and large hospitals nationwide to find patients quickly. It is the first of its kind in the world. As previously mentioned, the February 2020 is the first wave of mass infection broke out in Daegu area. At this time, to accommodate a large number of the patients due to the sudden outbreak, Korea opened the world's first residential treatment center for mild patients. In March, the WHO officially declared the COVID-19 pandemic worldwide. The Korean government implemented a 5-day rotation face mask distribution system to cope with the short supply. In April, the emergency COVID-19 relief fund was contributed to all citizens. I got them, yeah. In June, school finally reopened for all students, allowing them to actually go to the school, not online. However, in August, unfortunately, the second wave broke out in the Seoul metropolitan area, Korea's capital. In September, the Korea Center for Disease Control and Prevention, KCDC, was promoted to the Korean Disease Control and Prevention Agency, KDCA. And in October, wearing face mask in public area becomes statutory. By winter, the third wave of infection occurred and more than 1,000 patients were reported daily. The government had to tighten social distancing measures, prohibiting 5 or more people from gathering. During the Chuseok and the Lunar New Year, the biggest holiday in Korea, the phenomenon of mass migration for family gathering from all over the country was no longer seen this last year and this year. As the February 3rd, 2021, there were a total 79,311, at present 8,000 confirmed cases, 1,441 deaths in Korea since the first patient. Next, please have a look at the global COVID pandemic situation. First COVID-19 cases happened in November 17, 2019 in China, Wuhan, as you know. As of February 3rd, 2021, there were 104 million confirmed cases, 2,262,000 deaths, with the highest number of infection and deaths in the United States. Yes, let's take a quick look at novel coronavirus disease itself. The most common symptoms of the COVID-19 are fever, cough, dyspnea, and altered sense of taste and sense of smell. Less common symptoms such as myalgia, fatigue, etc. may appear as well. In the United States and the United Kingdom, COVID-19 patients having high fever over 38 degrees Celsius or low oxygen saturation less than 94% can be hospitalized. And then those who have advanced severe respiratory failure is transferred to the intensive care unit. In Korea, almost all confirmed cases are admitted to the hospital or residential treatment center. According to the statistics, most common criteria of institutionalization were 2 or 2 or more symptoms in hospital admission, no symptom in residential treatment center. In Korea, in the WHO COVID-19 severity level, mild illness is classified by not having hypoxia or pneumonia. Moderate disease has pneumonia and oxygen saturation over 90%. Severe disease has pneumonia and oxygen saturation below 90%. And critical disease by ARDS, acute respiratory distress syndrome, or septicemia. According to the US NIH, 1% of asymptomatic, 80% have mild and moderate illness, 14% severe, 5% critical. According to the data from KDCA in Korea, 90% were mild disease, 90% were mild disease, and remaining 9.1% include moderate, severe, and critical cases. Now let's get down to main topic, face of COVID-19 and role of health professionals. This model was developed by myself to understand the face of COVID-19, which goes through prevention, screening, treatment, and then patient get better, follow-up and survivorship. Patient get worse, end of life care. It's a phase, trend. When patient, during all these 5 phases, patient should be given psychological and socioeconomic support. In prevention phase, physician and public health nurse plays an active role, with officials take on the job promoting and guiding the public. In screening and diagnostic testing phase, physician, nurse, medical laboratory technician are responsible for quick COVID-19 test and correct result. During the treatment phase, physician, nurse are active. Especially intensive care unit nurse plays very important role in managing patients with critical life-threatening conditions. In the follow-up phase, patients were discharged from the hospital, and the role of public health nurse, physical therapist, occupational therapist, clinical psychologist are required. In palliative and end-of-life care phase, the role of a nurse, hospice and palliative care specialist, and funeral director are required. In the COVID-19 prevention phase, face mask, social distancing, disinfection, and vaccine are major tasks. In screening and diagnostic phase, body temperature measurement, questionnaire, RT-PCR test, and antibody tests are conducted. In the treatment phase, the treatment modality varies according to the stage of mild, moderate, severe, and critical illness. The role of intensive care nursing is crucial for critical cases. During the follow-up phase, physiological, psychological, social problems may arise, so be prepared to manage them well. When patient with poor progression enters the end-of-life care phase, it is necessary to help the patient to say goodbye properly to family in an isolated situation, to provide appropriate spiritual care. When a COVID-19 patient dies, strictly limited cremation and funeral must be performed to prevent spread of the infectious disease. At this time, healthcare professionals should comfort the family in grief and embarrassment. Let's take a closer look at each phase, starting with the prevention phase. COVID-19 prevention targets all population, all citizens. So education and promotion of the prevention measures are very important. The left is Korean KDCA's proportional material. The right is the US CDC's proportional material. Public officials and the community health nurses are primarily responsible for education and public relations. Face mask is the best preventive measure, as you know. In Korea, KF94 masks are mostly widely used. In the US, medical staff use an N95 masks, and the general public, they cannot get the N95 masks. So, general public is advised to wear 2 masks, putting cotton mask over the surgical mask. He is Anthony Fauci. He wear the 2 masks. In Korea, a 5-level social distancing guideline is implemented with 2-meter distance between any person recommended. Now, there is a game changer in prevention of infectious disease. It is the vaccine. As of February 3rd, the number of vaccination has surpassed the number of confirmed cases. It commenced the counterattack by humans who were attacked by the novel coronavirus. By countries, 35 million in US, 25 million in China, 10 million in UK, and 5 million in Israel was vaccinated. In particular, in Israel, over 50% of the whole country was vaccinated. The effect of vaccine is dramatic. The number of COVID-19 cases is rapidly decreasing. It peaked at 820,000 on January 8th, but reduced down to 370,000 on February 6th. In Korea, vaccinations are scheduled first for medical personnel from late February. Next is the screening and diagnostic test phase. The all population are subject to basic screening when entering public and private sites. Body temperature and breath questionnaire are used for initial screening. To confirm COVID-19, a molecular test, RT-PCR, real-time reverse transcription polymerase chain reaction, is performed. Samples are collected with nasopharyngeal via nose, nasopharyngeal swab, and oropharyngeal swab via mouth. In the UK and Japan, this RT-PCR test was conducted only on symptomatic patients whose symptoms persisted for a considerable amount of time. In the United States, it was conducted for both symptomatic and asymptomatic cases, but asymptomatic patients were limited to those who were deemed necessary by medical personnel. In Korea, people can get an anonymous RT-PCR test at a temporary screening clinic free of charge, regardless of symptom. Physician, nurse, and medical laboratory technician performs this screening test. Treatment for COVID-19 is done in people confirmed to be infected with the coronavirus. As for the location of care, In United States, patients with mild disease are treated in hospital, community facility, or at home. The home isolation can be considered for most mild patients. Patients with moderate disease are also treated in hospital, community facility, or at home. The home isolation can be considered for low-risk patients. Patients with severe disease are treated in hospital. Patients with critical disease in intensive care unit. But Korea is different. In location of care for COVID-19 patients in Korea, people with mild disease are admitted to hospital or residential treatment center. Home isolation cases are very low. Patients with moderate and severe diseases are hospitalized for treatment. Patients with critical disease are treated in intensive care unit. Korea has very wonderful healthcare system. People with mild disease receive some symptomatic management such as residential hospital. People with mild disease receive some symptomatic management such as antipyretics to lower a fever or honey to suppress a cough in the UK. In the UK, many patients with mild disease are treated at home. So, sweet honey, you know sweet honey. Honey is suggested to suppress cough. Patients with moderate disease are treated with antibiotics and corticosteroid with or without remdesivir. Patients with severe disease use oxygen therapy. It is very important to provide intensive care for the critical COVID-19 patient. Mechanical ventilation, ECMO, is very important equipment for the critical patient. Mechanical ventilation is used to address severe respiratory failure, and ECMO, extracorporeal membrane oxygenation, should be applied when both heart and lung are not functioning. In ECMO, blood is pumped outside of the patient's body to a heart-lung machine that removes carbon dioxide and sends oxygen-filled blood back to the tissue in the body. Blood flows from the right side of the heart to the membrane oxygenate in the heart-lung machine, and then is rewarmed and sent back to the body. This method is very difficult method. So this method allows the blood to bypass the heart and lung, allowing these organs to rest and heal. For such treatment, competent intensive care unit nurses are key personnel. The Korea National Medical Center opened an ICU, intensive care unit nurse training program for COVID-19 critical patients at 23 hospitals across the country. Through this program, 380 critical care nurses were trained. My research team was in charge of monitoring this project. The ratio of COVID-19 clinical severity in Korea as followed. No limit of activity was 87%. Limit of activity but no oxygen is 3.6%. Use invasive ventilator is 0.2%. Use of ECMO was 0.2%. People who are discharged from the hospital after COVID-19 treatment are eligible for the follow-up phase. More than half of the hospitalized COVID-19 patients have complained of reducing lung function after discharge. This situation is called the post-COVID-19 syndrome or long COVID. In UK, 75% of COVID-19 patients remain symptomatic after 3 months. A survey conducted on 40 discharged patients in Korea shows that 43% suffer fatigue, 35% suffer dyspnea while exercising, and 23% reported hair loss after leaving the hospital. Hair loss is a distinct complaint to Koreans. In the follow-up phase, psychological problems are also significant. Stigma, depression, isolation, post-traumatic stress disorder may occur. The social ostracism is also a problem to take an interest. COVID-19 survivors are stigmatized and suffer from social prejudice and criticism. So some patients choose not to reveal that they have had COVID-19. So it is difficult for them to return to work, and some survivors suffer financial difficulty from shutting down their business or leaving the company. Physical therapists, occupational therapists, social workers, and clinical psychologists are needed to rehabilitate the COVID-19 survivors. Finally, the subject of the end-of-life care phase are dying patients with advanced critical COVID-19 disease. It is very painful to die alone in an isolated room. Patients deserve special consideration, such as saying goodbye to their family via voice or video call on telephone, tablet, smartphone. Hospice and palliative care specialists provide spiritual and psychological support for patients, not physically, just virtually. Family of dying patients with COVID-19 are also very painful and feel embarrassment. Family members wear PPE, personal protective equipment, and go into the world to see the patient not directly, through grass. Write letters or present through grass or listen to their last word via interphone. When a COVID-19 patient dies, he or she cremated first and then has a funeral to prevent the spread of the infectious disease. The whole process can feel unfamiliar and unrealistic, because family members have to stay out of the process, unlike traditional funeral. The help from competent funeral director is desired. As discussed earlier, various healthcare professionals are required at all phases of COVID-19. Rather than working alone, they should work together as a multidisciplinary team. The ultimate goal is to prevent the spreading of the novel infectious disease like COVID-19, assist the affected person where to achieve the best result, and stay with them till the last minute if required. There have been many terrifying infectious diseases throughout the human history, from pest to SARS, MERS to COVID-19. The cycle of the new infectious disease appearing is shorter. Just 9 years, 7 years, 4 years. After 4 years, another new novel infectious disease is coming to us. We don't know. But we will certainly face another new epidemic, but we will overcome it again with the power of science, collaboration, and love. Yeah. it's the end. Thank you for, for your attention. Thank you.
Thank you for her insightful presentation. Let's give her another round of clap, please. All right, this is the end of the opening session, and I'm grateful to all of you who spared your time to attend it. For the next 1 hour, you can take a break, and at the same time, you can watch the video clips of student poster presentations. I will announce 5 outstanding student presentations at the closing session. Please, I ask you to attend the session meeting in your field starting at 1 p.m. Korea time. We will gather here again at 4:30 Korea time for the closing session. I will see you then and have a great time. Thank you very much. 자, 이것으로 1부 행사가 끝났습니다. 돌아가실 때 도시락 챙기시고 세션 프레젠테이션 할 때 다시 뵙도록 하겠습니다. 감사합니다.
Hello, we are the Steve Nurse team from Daegu Health College. The topic of our study is the effect of self-efficacy and attitude toward volunteering work on voluntary satisfaction in nursing college students. Now, let's start the presentation. Can you tell me about the background of this study?
Through volunteering, you can interact with various candidates and create learning opportunities to learn human dignity and trust. Self-efficacy influences the nursing students' belief in nursing performance. Therefore, through the study, it is intended to provide essential data for improving the self-efficacy and attitude toward volunteering work of the nursing students.
What is the purpose of this study?
This study was conducted to explore factors related to volunteer satisfaction among nursing students.
How was the research conducted?
This study collected data using a questionnaire from May 21st to 28th from 182 students studying nursing at the college in the metropolitan city. For analyzing the data, descriptive statistic, t-test, ANOVA, Pearson correlation analysis, and multiple regression analysis were used.
Can you tell me about major results of this study?
First, if you look at the general characteristic, most of the candidates are women who was in their 20s. Most of the students do not have religion, and almost 57.7% of the students had done over 20 hours of volunteer work. About the type of volunteer work, almost 77.4% of the students did social welfare activities. 49.5% of the students said that the motivation of volunteering was to meet graduation and employment requirements. The students were encouraged to become most engaged in voluntary activities by their friends. This was the highest rate. The most notable suffering that volunteers had was financial and time. The second table shows the differences in volunteer satisfaction according to the general characteristic. There were significant differences in gender and religion. The men showed more satisfaction at volunteering than women, and students who do not have religion shows more satisfaction at volunteering than students who have religion. The third table shows the relationship between the candidates' self-efficacy, volunteer attitude, and volunteer satisfaction. Self-efficacy was significantly correlated with volunteer attitudes and volunteer satisfaction. Also, volunteer attitudes had significant correlation with volunteer satisfaction. Lastly, the fourth table shows the factors that affect the candidate's voluntary satisfaction. The table shows that volunteer attitude and self-efficacy significantly impact on volunteer satisfaction. Volunteer attitudes are interpreted to have a greater impact on volunteer satisfaction than self-efficacy. In other words, the higher the attitude of volunteering and self-efficacy, the higher the satisfaction level of volunteer service. Therefore, in order to increase volunteer satisfaction in nursing college students, it is necessary to develop a specific strategy to improve self-efficacy and attitude of voluntary work by using sufficient pre-education before participating in volunteer and feedback programs. Thank you for listening.
Hello, my name is Hyuna Jo. The name of our team is Seven Sleeping Princess. The title of our study is Effect of Smartphone Dependence and SNS Addiction Tendency on Sleeping Quality among University Students. The purpose of our study was to identify the effect of university students' overdependence on cell phone and SNS addiction tendency on the quality of sleep and to identify their correlation. The second is research method. The study surveyed 148 university students living in this city. The data was analyzed using the SPSS 18 for Windows program, ST-Test, and ANOVA. This study was investigated from 19 October to November 2020 as a descriptive research study. We collect the data through Google questionnaire. This is the result of showing the difference in the quality of sleep, the tendency of smartphone over-reliance, SNS addiction, and sleep depending on the general characteristic. There was statistically significant difference in smartphone overdependence depending on gender, grade, and interpersonal relationship, where women were more dependent on smartphone than men, and in grade, the higher the grade, the lower the dependence on smartphones. The better interpersonal relationship, the lower the degree of reliance on smartphone, and the higher the average amount of SNS use per day. The higher the degree of over-reliance on smartphone, and there was statistically significant difference. There was statistically significant difference in SNS addiction tendency depending on gender, class, concentration, overall grade, interpersonal relationship, and physical activity, but in gender, women tended to have SNS addiction more than men. The better the concentration of class, the lower the tendency of SNS addiction, the higher the mean rating. The better interpersonal relationship, SNS addiction tendency was lower, and in physical activity, the more physical activity, the lower the tendency to SNS addiction, and the statistically significant difference. There were statistically significant difference in the quality of sleep depending on grade, interpersonal relationship, mainly use smartphone content, and daily average SNS usage time. The higher the grade, the worse interpersonal relationship, the quality of sleep was good, and there was statistically significant difference. In content that is used mainly for smartphone, the quality of sleep for those who do SNS was the best, and there were statistically significant difference. The shorter the average daily SNS usage time, the better the sleep quality and the statistically significant difference. Next, relationship between smartphone dependence and SNS addiction tendency of sleep quality. SNS addiction tendency shows a statistically significant direct correlation. Smartphone dependence R equal 0.603 and P less than 0.001, while sleeping quality show a significant immediate correlation with smartphone dependence and SNS addiction tendency. Stepwise multiple regression analysis was performed to investigate factors affecting the quality of sleep, and as a result of multiple regression analysis, the regression model was found to be significant. The most important predictor of sleeping quality was the SNS addiction tendency. P equal 0.011. The conclusion, a notable result in this study is that the degree of smartphone dependence among university students does not significantly affect sleeping quality, but the higher the SNS addiction tendency, the lower the sleep quality. With this, I will end my presentation. Thank you.
Hello, today we are here to present our thesis poster. This is 조슬기.
This is 이혜본.
We keep proceeded the research with this subject, the effects that knowledge and health beliefs on the response of infectious disease among nursing department students on COVID-19. Actually, we all know that the most hottest topic in our world is COVID-19 in 2020. So, as we are the nursing department students, we want to make our thesis not just simply dealing with the COVID. We hardly try to take an essential approach to understand how valuables such as knowledge and health beliefs of nursing students about the COVID infectious disease and how affect their response to the infectious disease. Through our research, we also want to contribute to other theses and continuing studies. This study was subjected to nursing department students of this city, and it's a descriptive research study to understand relationships between knowledge, health belief on infectious disease response, and the influencing factors. Research tools are totally three. For knowledge of COVID-19, we used the edition 723 of the COVID virus infectious 19 response guide presented by the Centers of Disaster Control and Preventions, which made in 2020. Second, for the health belief, we used the modified and supplemented tools, which is health beliefs measurement for MERIS by Gewari in 2017. Third, for the response to infectious disease, we used a tool which was made based on IC and disaster nursing capacity framework and developed it by Yumi Park in 2020. All tools were modified directly by us to meet our purpose and content, and we checked the reliability by using the reliable values.
And now I look at the table and tell you the research conclusions. Figure 1, 2, 3 are impacts of general characteristics on the response of infection disease. According to Figure 1, among health promotion activities, exercise was about 96 points, the highest score in response to infection disease. Figure 2 shows that the higher the satisfaction level of the measure is, the highest the level of satisfaction with the infection disease response score. In Figure 3, the score for responding to infection disease based on educational experience was about 99 points when they experienced education, which was higher than when they did not experience education. In the end, Table 1 is COVID-19 correlation between knowledge of infection disease, health beliefs, and response to infection disease. The higher the level of the knowledge and health beliefs about COVID-19, the higher the ability to respond to infection disease. Table 2 is factors affecting the response of infection disease. Non-smoking during health promotion activities, corona education experience, the sub-factor of health beliefs, such as beneficial and trigger of action, had a statistically significant impact on the ability to respond to infection disease. As a result, the most affected factor is non-smoking. The following factors influenced the trigger of action, beneficial, and corona education experience. This is the end of the presentation. Thank you for your attention.
Hello, this is a paper about the theme of effective of sexual knowledge, sexual awareness, and gynecological visit recognition on the women's health promotion behavior, and I'm Jang Nari from Girls on Top team who are announcing. The background of this study is that college students are traditional periods of transition from adolescence to adulthood given Erikson's developmental stage. At this time, rapid physical growth and physiological changes cause confusion in identity. Our country has the characteristic of an educational system that allows free dating only after coming to college. Therefore, college students may feel sexual impulses with intense curiosity, which may lead to sexual deviance. This may affect the information of reliable relationship during meeting with various opposite sexes, and it can cause reproductive health problems such as human commercialization, lack of social morality, and unwanted pregnancy, abortion, and sexual transmitted diseases. Next, the purpose of this study is to identify female college students' perceptions of sexual knowledge, sexual awareness, and visit to obstetrics and gynecology, and to determine how much it affects women's health promotion.
Through it, it is intended to contribute to the correct women's health promotion of female college students by providing information that supplements and corrects sex education. The method of this research are that the subject of the students were female students in grade 1st to 4th who are currently attending university. 189 people who agreed to participate in the survey were selected as the final target person. The online survey was done through labor form questionnaires, which was included measurements of sexual knowledge, sexual awareness, gynecology, visit recognition, and women's health promotion. The data were analyzed by SPSS. Look at the poster. The first table is a result of examining the degree of sexual knowledge, sexual awareness, gynecology visit recognition, and women's health promotion. The figure 1 shows sexual knowledge, sexual awareness, gynecology visit recognition, and women's health promotion differences according to the general characteristics. T-test and ANOVA was used for analysis, and the figure shows the results, which were significant differences. Sexual knowledge was significantly higher in the health-related major than in the non-health-related major. The sexual awareness scored higher in students who live boarding dormitories and other areas than who in home living alone. Women aged 30 or older scored higher in women's health promotion than those who aged 19 or younger and 20 to 29, and students who come from girls' school scored higher in women's health promotion than co-education school. The second table is the correlation between sexual knowledge, sexual awareness, gynecological visit recognition, and women's health promotion activities. There are significant correlation between sexual knowledge, sexual awareness, gynecology visit recognition, and women's health promotion activities. And the lower the score, the sexual awareness, gynecology visit recognition, and women's health promotion activities, the higher the perception and sexual behavior. Therefore, women's health promotion is significant positive correlation with sexual awareness, gynecology visit recognition. The last table shows factors affecting the promotion of women's health. The biggest influence on the women's health promotion of female college students is the sexual awareness, followed by gynecology visit recognition. And sexual knowledge does not seem to have a significant impact. In conclusion, our research shows that the female college students' sexual knowledge and gynecology visit recognition were moderate, and sexual awareness and women's health promotion activities shows high levels, and the higher the sexual awareness and gynecology visit recognition, the better the women's health promotion. Therefore, the higher the sexual awareness and gynecology visit recognition, the higher the increase in the women's health promotion activities. In order to improve women's health promotion activities, it is necessary to develop and introduce practical and specific women's health-related awareness improvement program rather than to educate women's university students. Thank you for listening.
Hello, we are Kim Yeonji and Han Sora, who are in charge of the presentation of Daegu College Angel in Nurse team. The theme of our research is compared to COVID-19 at online-offline lectures, comparison of self-controlled learning, learning immersion, and academic satisfaction of nursing college students. The purpose of this study was to understand and compare self-controlled learning, learning immersion, and academic satisfaction to see the difference between online and offline classes as COVID-19 continued to distance students from each other. In this study, the neighbor form questionnaire was distributed to 600 students who attended both offline and online lectures, except for freshmen who have never attended offline lectures at the college. The survey used online-offline self-controlled learning, learning immersion, and academic satisfaction tools.
I will explain our research results with these tables. First, Table 1 shows the general characteristics of the study. In our study, 84.5% of the students were female. More than half of the students were third-grade students. 85.2% of the students have listened the online class during the time of 10 o'clock in the morning to 22 o'clock at night. In our study, only 20% of the students have to part in the class according to the schedule. 32.3% of the students have listened the class on weekdays, and the other students have listened the class at weekends or just leave it on or learning when they feel like it. Table 2 is online self-control learning, learning immersion, and academic satisfaction according to general characteristics. There was significant difference in self-control learning according to type of online learning. The others showed no significant differences. Table 3 shows a comparison of subcategories in self-control learning, learning immersion, and academic satisfaction, both in online and offline classes. There were significant differences between offline and online classes in all variables, and the offline classes were all significantly higher than the online classes. Table 4 and 5 show the correlation of subcategories between self-control learning, learning immersion, and academic satisfaction, each of offline and online classes. All the subcategories in self-control learning, academic satisfaction, and learning immersion in online and offline classes showed significant correlation. Table 6 shows the effect of the general characteristics and the sub-region of self-control learning and learning immersion on academic satisfaction at online classes. According to the results, online self-time management strategy showed the most effect to the academic satisfaction. Lastly, the Table 7 shows the effect of the sub-region of self-control learning and learning immersion on academic satisfaction at offline classes. According to the results, offline self-efficiency showed the most effect to the academic satisfaction. In conclusion, it is expected that the online lectures could not produce more positive responses than the offline lectures from the nursing college students in a situation where the sudden COVID-19 forced them to take the online lectures. In preparation for these situations, alternative plans need to be developed and follow-up research is needed to understand and control the impact factors other than the online learning type and learning time zone. Thank you.
Our team is Nagake Hejo, who participated in the 9th Nursing College Conference. I would like to briefly explain the poster that was awarded at this nursing conference. Starting in February 2020, COVID-19 is spreading at a rapid pace, and social distancing in everyday life has been emphasized, leading to refrain from meeting and going out. In addition, as the COVID-19 infection spread, unexpected problems such as economic difficulties and interruption of daily life, as well as health stress, are occurring. As with daily life, more and more people are suffering from psychological abnormalities such as depression and lethargy. Due to these problems, our team conducted a survey of 140 college students in Daegu to understand the conflicts in daily life caused by COVID-19 and how they affect before and after the COVID-19 incident. So, we conducted a study on the topic impacts of COVID-19 on depression, stress, and quality of life. Research method was carried out in the following ways. The general characteristics of the target person and the frequency of travel before and after COVID-19 are analyzed as descriptive statistics. Analysis of the variation by general characteristics factor of response to test subjects before and after COVID-19. The frequency of going out before and after COVID-19 is analyzed as ANOVA, and the post-verification is analyzed as a self-test. Correlation analysis of the change in the quality of life, stress and depression before and after the COVID-19 incident of the entire subject through the response sample test. Table 1 difference according to difference of age, economic, and living pattern. Students whose age is higher than 25 years old, who have low economic level, and who did not live with parents showed more depressed. There are no significant difference in depression and quality of life according to general characteristics difference. Table 2 shows depression, stress, quality of life according to the number and purpose of going out. The results are as follows. The frequency of going out before and after COVID-19 did not significantly influence depression, stress, and quality of life. But before COVID-19, economy as the primary purpose of going out, and after COVID-19, education activities significantly affected on it. Table 3 shows the difference of depression, stress, and quality of life before and after COVID-19. Those showed significant increases in depression and stress after the COVID-19 outbreak, while the quality of life decreased more after the COVID-19. Inclusion found that COVID-19 affects depression, stress, and quality of life.
That's it for the presentation. Thank you.
Hello, I'm Kwon Hyun from Daegu University. Today's presentation topic is the future-oriented clinical pathologist. The first is COVID-19. I present about the characteristic of countries with high infection rates and how to deal with Korea. The last is post-COVID. We will announce the role future clinical pathologists can do for us who have to live in post-corona world. First of all, regarding the first corona outbreak in Wuhan, China, it started in December 2019 and was declared a pandemic on 11 March 2020 by the WHO after 11 years of infection worldwide. For example, I compared the situation between Korea and Italy. This graph is the number of confirmed cases. Why do the two countries show us such a difference? Italy violated restriction on movement and showed a lack of civic awareness. However, Korea has implementing isolation, guiding the path of confirmed people, sending emergency text message, and drive-through. The most important thing is a quick initial response. In addition, Korea's corona response is an excellent example like textbooks, says Deputy Director of Emergency Preparedness and Response. Now, corona may be giving us time to change our close environment. Corona has brought about a non-face-to-face society, and this change is expected to continue in the future. With regard to the fourth industrial revolution, we did a survey of students. The result is infectious disease control programs accounted for the largest proportion with 47%. Regarding the front slide, this slide is about education at the Senior Wellness Center at Daegu University. Senior Wellness Center is a place where you can practice virtual reality. It would be nice to use virtual reality and artificial intelligence to prepare students for various diagnostic examination practice, such as sampling and polymerase chain reaction tests. We should become a clinical pathologist who accept the post-corona and understand artificial intelligence-based disease diagnosis. Thank you for listening.
Hello everyone, my name is Nachita Sinkansana. I'm a master degree student of Faculty of Associated Medical Science from Khon Kaen University, Thailand. Today, I would like to present a poster about effect of urine concentration on urine assay for the diagnosis of strongyloidiasis. I'm going to start with introduction. Strongyloides stercoralis is an intestinal parasite which can infect humans and cause of strongyloidiasis. That is one of neglected tropical disease or NTD. Several serological tests have been developed for increasing sensitivity. The detection of antibody by enzyme-linked immunosorbent assay or ELISA in urine has been developed because urine is easy collecting and non-invasive method. However, false negative result of urine antibody detection but showed positive physical examination was occurred. So, the aim of this study is to test the improvement of urine antibody ELISA by adding concentration step of urine before using in conventional urine ELISA. The method of study including physical examination by agape culture technique or APCT, urine concentration step by centrifugation of urine in filter tube for 10 minutes. The remaining supernatant urine volume were tested for antibody detection by urine ELISA testing. The result of post-concentrated urine was compared with result of unconcentrated urine and agape culture technique. For the results, Table 1 shows comparative diagnostic accuracy of agape culture technique and unconcentrated urine ELISA and post-concentrated urine ELISA methods. There were 148 cases that was selected in this study. Stonsillosis cercoralis were found in 35 cases by agape culture technique, while 40 cases were positive by unconcentrated urine ELISA. Among 35 positive by agape culture technique, 28 cases were negative and 7 cases were positive by unconcentrated urine ELISA, whereas all of them were positive after urine was concentrated. Among 40 cases positive by unconcentrated urine ELISA, positive results were observed in all post-concentrated urine cases. There were only 16 negative of post-concentrated urine ELISA. There were negative by both agape culture technique and unconcentrated urine ELISA. From 148 cases that we include in this study were divided into 4 groups based on antibody unit by urine ELISA, including low negative, high negative, low positive, and false negative, who has negative urine antibody results but found on lava in feces by agape culture. Figure 1 shows antibody units of unconcentrated urine comparing post-concentrated urine at 10 minutes. The antibody unit of post-concentrated urine were found higher than unconcentrated urine. For high negative and low positive group, concentrated urine were 40 positive cases, or 100%. Conversely, there were only 24 cases of low negative group that post-concentrated urine was found positive. Interestingly, there were 28 false negative group that found lava positive but negative antibody results. After concentration step, the result of antibody unit was changed from negative to positive result 100%. So, the adding step of concentration can improve urine ELISA for stonsilloidiasis detection. This concentrated urine ELISA might be applied for stonsilloidiasis screening in endemic area, especially population who get negative result by conventional urine ELISA and risk group who has low immune response. In addition, concentrated urine ELISA might be used for follow-up after antiparasitic drug treatment. Thank you for your attention.
Good morning, ladies and gentlemen, and welcome to my presentation. My name is Na EER. I am second year master student in Medical Science program at the Faculty of Associated Medical Science in Konkan University, Thailand. Today, I am presenting a preliminary one. You see the data set of the clinical characteristic of acute myeloid leukemia patient and the result from my work. And I am focusing on FLT3 mutation among acute myeloid leukemia patients in Northeast Thailand. So let's get started with the introduction. Acute myeloid leukemia is a phenotyping and genetically heterogeneous group of clone neoplasm, and it results from the uncontrolled proliferation and arrest in the differentiation of hematopoietic progenitor cell. The AMN is the most common type of leukemia in attack and is highly aggressive. And we have found the FLT3 mutation in approximately 7 to 10% of AMN patients, and this mutation is associated with complex prognosis effect, and they also appear as a major mechanism of resistance to FLT3 inhibitor in AMN patients after treatment with FLT3 inhibitor. Therefore, FLT3 testing is important not only at the initial diagnosis but also after treatment with FLT3 inhibitor. So, we aim to investigate the prevalence of FLT3 mutation and their clinical prognosis based on the body feature of AMN patient in Northeast Thailand. So, in this one, we use the PCR family method to identify the FLT3 mutation, and we further confirm the mutation by the DNA sequencing. Now, let's move on to the research section. In this one, we identified the first TKD mutation in 7 patients, which has accounted for 10.3% in Northeast Thailand AMN patients. The median age of the TKD positive patient was 49 years, and the peripheral blast percentage in TKD positive patients were significantly lower than the first wild-type cases. This result may be because our study includes not only de novo AMN but also therapy-related AMN cases. However, we found no significant difference between gender, age, other hematological features, and the FAB subtype between 50 TKD and the 50 wild-type cases. And this is the result of 50 TKD mutation and seen in the electroskeletal electrophoresis and the sequence analysis. Normally, EcoR5 targets the 50 wild-type into two bands, heavy 295 base pair and 260 base pair. However, EcoR5 cannot target the 50 TKD mutant, so you can see the 50 TKD mutant heavy 555 base pair at the lane 3. And you can also see the sequence analysis of two patients with 50 TKD mutation as shown in figure 2. In patient A, the third nucleotide series of codon A36 was substituted with G, which present an isoleucine to methionine amino acid chain. And in patient B, the second nucleotide T was substituted with A, resulting in an isoleucine to asparagine amino acid chain. Most of the TKD mutation occurred at the codon A35. However, in our study, the TKD mutation mostly occurred at the codon A36. And overall, this is the fast report of 50 TKD mutation in Northeast Thailand, and the prevalence is as high as other regions in Thailand. And therefore, we recommend the further investigation in prognosis impact of this mutation. And hopefully, this preliminary data should be useful for selecting targeted treatment therapy for AMN patients harboring this mutation. And finally, I would like to say thanks to my faculty and Daegu Health College for giving an opportunity to present this work.
Everyone, my name is Jenjila Latiporn. I'm studying Associated Medical Science from Khon University, Thailand. At present, COVID-19 has spread over the world. So important thing is measure your body temperature for check your body. And equipment for use to measure body temperature, for example, is that infrared thermometer or mercury thermometer. For true equipment, any person can use by yourself and can measure from many sides of body, and after use many sides of body, it give different value. I think it's very important because to check sure your body temperature. Today, I would like to talk about different side body temperature measurement using infrared thermometers in healthy adult individuals and a comparison with auxiliary digital mercury thermometers. For this study, aim to compare body temperature measurement at the forehead, temporal, and wrist side using an infrared thermometer. Moreover, indifference between the temperature reading from the infrared thermometer and the digital mercury thermometers was evaluated. For research, we studied from a total of 158 healthy students of a faculty of Associated Medical Science, Khon University. After that, we repeat measure from ANOVA and Brand-Ehrman method was calculated. For the result, it showed the temperature measured at risk was statistically significant, different from the forehead and temporal. For p-value less than 0.0001, then the mean temporal temperature was similar to that of forehead temperature, p-value equal 1. But the auxiliary temperature obtained by digital mercury thermometer was lower reading than forehead temperature reading by infrared thermometer. That mean difference between these two devices are trained to decrease when the body temperature higher than 37 degrees Celsius. It shows you from figure 1 that trap band an element cut off temperature measurement with an infrared thermometer and digital mercury thermometer, showing that mean difference and 95% limits of agreement. So at the last, this study gives you for head and temporal side temperature by using infrared thermometer measurement are not different. The infrared thermometer could give a relative measurement value with a digital mercury thermometer at a high temperature and normal situation. So thank you for your attention.
Hello everyone, I'm Ms. Nopala Sanklis, the fourth year PhD candidate in Human Movement Science program from Khon Kaen University, Thailand. My poster title is Correlations between Segmental Postural Control and Sitting Development in Moderate to Late Preterm Infants, aged from 4 months until the age of independent sitting attainment. The introduction. Inadequate of segmental postural control can be inferred from delayed onset of upright gross motor development in preterm infants. Identifying the correlations between segmental postural control and the development of sitting could help to promoting optimal gross motor development. However, data on this topic in healthy homeless premature infants where longitudinal design is still limited. Therefore, the objective of this study was to examine the correlation between segmental postural control and sitting development through series assessment from age of 4 months until the age of independent sitting attainment. The method of this study. 33 moderate to late premature infants were assessed using the segmental assessment of trunk control or SASCO and sitting development by the Avatar Infant Motor Scale or AIMS. This figure showed infant was evaluated his gross motor development using the M-type version. This figure showed the infant was tested with 3 conditions of the segmental level of trunk control, including static, active, and reactive conditions. Both tests were performed monthly starting when the infant aged 4 months until the attained the independent sitting. The age of independent sitting attainment was indicated when the infant was able to sit on the ground without arm support and play with the object with both arms. Subsequently, assessment occurred on the same day, with plus or minus Friday of every month. The correlations were analyzed using the Spearman-Rand correlation coefficient. The result of this study. This figure shows the correlation between SATCO and the AIMS subscale score. The significant fair to good correlation between the segmental trunk control and sitting scale were found at 4 months, 5 months, and the age of independent sitting attainment. Discussion of this study. The current prospective study found the magnitude of significant correlation increased with age from fair to good. Corresponding to this result, the effect size from 4 months until the age of independent sitting was also increased. The late premature infant in the current study could sit independently at 7 months and 5 days. Generally, around 55% of infants could sit independently at 7 months corrected age, the lowest to the highest level of trunk control, while sitting independently occur between the lower thoracic to upper lumbar. Late premature infant in our study gain independent sitting within the range of window development in typically developing children. It is recommended that using the SATCO to assess the level of segmental trunk control in premature infant would be practical for possible prevention for delayed development of sitting. Although the correlations between segmental postural control and sitting ability were significant in this study, the magnitude of the correlation were fair to good. Examine the correlation between two outcomes could display some extent of contribution between the segmental trunk control and sitting development. A future study might investigate more relevant variables that potentially affect the chain of ability as segmental postural control during sitting. Further studies could yield a deeper understanding of the environmental factors surrounding preterm infants that might contribute to altering development of segmental trunk during sitting. Conclusion of this study: the magnitude significant correlation increased from fair to good with age in moderate to late preterm infant. This study was supported by the Research Center in Back, Neck and Other Joint Pain and Human Performance of Faculty Associate Medical Science, Khon Kaen University, Thailand. That is all of my presentation. Thank you for your kind attention.
Hello everyone, my name is Sananta Prongmin. I am PhD student from Khon Kaen University. Today I would like to present the topic of effect of starter play on intravariability of gross motor and language development in orphan infant aged 6 to 10 months. The purpose of this study therefore were to investigate the effect of 45 minutes play in upright position on the intra-individual variability and to examine the relationship between gross motor and language development in institutionalized infants aged 6 to 10 months. 10 healthy infants aged 6 to 7 months were included from Orphanage of Thailand. Each infant got 45 minutes stimulation program 3 days per week for 12 weeks by the physical therapists who have at least 4 years experience in pediatric physical therapy. This 45 minutes stimulation program consists of 30 minutes starter play and 15 minutes free movement activity. The 30-minute play in upright position, each child got a chance to perform sit to stand, cruise, walk, or being outside the building for 30 minutes. Listen to the storybook reading and activity play for 10 minutes. Our infant got a 14 minutes free play activity including creeping, crawling, or independent sitting with object interaction. Gross motor development of each infant was evaluated by a physical therapist using the AIMS Thai version. The early communication behavior development of each infant was observed by the family caregiver using the CSB-SDP prior to and after obtaining the stimulation program. The gross motor development and language were reassessed every month for 3 months. The assessor who performed the AIMS and the CSB-SDP was parted from the score summation. Table 1 shows characteristics of participants, 6 boys and 4 girls. Figure 1 and 2 show the intra-variability of percentile of gross motor and language development. 7 of 10 participants display wide intra-variability of gross motor percentile of value more than the 50 percentile. 1 of 10 participants show little variability of gross motor development, which percentile were more than the 50 percentile. 6 of 10 participants has large variability of language percentile, and 7 participants with the highest value more than the 50 percentile. However, only 3 of 10 participants has less variability of language percentile, which were less than 50 percentile. The result of this study was in line with previous study of typically developing infants who has absolute change of gross motor development at least 40% time during the longitudinal assessment. The starter activity with early sitting was able to change the infant point of view as it is, providing new perceptual experience and encourage force-to-force exchange with their caregiver during sitting. That's all of my presentation. Thank you for your kind attention.
Good afternoon, ladies and gentlemen. My name is Loan. I'm come from Khon Kaen University in Thailand. Our study has title Effect of Transcranial Direct Current Stimulation Combined Physical Therapy in Chronic Low Back Pain Treatment. Let me introduce some general information related to our study. First of all, chronic low back pain is low back pain lasting more than 12 weeks with intermittent chronic symptoms. Transcranial direct current stimulation, or TDCS, is an invasive brain stimulation technique. It is a potential technique in reducing pain. Some studies combine TDCS with exercise, postural training, peripheral electrical stimulation in chronic low back pain treatment. The results show that TDCS can enhance analgesic effect of chronic low back pain treatment. Besides, physical therapy techniques are conventional methods in pain treatment. However, it is unclear that whether combination of TDCS with physical therapy techniques are more effective in chronic low back pain treatment or not. So we conduct this study aimed to compare analgesic effect between physical therapy alone and physical therapy combined TDCS in chronic low back pain treatment. This is randomized controlled pilot study. 20 participants were randomly divided into two groups, 10 participants in control group and 10 participants in experimental group. In control group, participants received hot pack for 15 minutes, ultrasound for 10 minutes, mobilization for 5 minutes, and back exercise. In experimental group, initially participants received TDCS with 2 mA in 20 minutes, with anode placed over primary motor context and cathode placed over contralateral supraorbital area. After that, participants received hot pack in 50 minutes, ultrasound in 10 minutes, mobilization in 5 minutes, and back exercise. All techniques were conducted 3 times per week in 4-week continuous needs. Pain intensity was measured by visual analog scale as baseline. Immediately finishing experiment, follow up after 1 week, 2 weeks, 3 weeks, and 4 weeks. The results showed that there were no significant difference in pain intensity between two groups, although both groups significantly reduced pain intensity over time. In conclusion, TDCS did not enhance analgesic effect when it combined with physical therapy techniques in chronic low back pain treatment. Thank you for your attention.
Hello everyone, my name is Pornpat Nyapirak, a master degree student at School of Physical Therapy, Khon University, Thailand. Today the topic of my presentation is validity and reliability of the Thai version of the Identification of Functional Ankle Instability, or IDFAI Thai questionnaire. The authors consist of Pornpat Nyapirak, Uraiwan Chachawan, Wantana Siri Thalathiwat, ยอดชายบุญประกอบ and ทกมลหันษาวงศ์ from School of Physical Therapy, Khon University, Thailand. Let's start from introduction. The long-term consequence of the lateral ankle sprain is called chronic ankle instability, but in previous study found the lack of consensus criteria to diagnosing CAI condition. Well, the internal Ankle Consortium provide the minimum consensus criteria to diagnosing this condition, including history of ankle sprain and score of ankle instability questionnaire. The IDFAI is the one of recommended questionnaire that has definition of ankle instability into its structure that efficient to identify CAI condition. However, the IDFAI was originally developed in English, so it's limiting to use among the Thai population. Therefore, my study aimed to translate the IDFAI questionnaire into the Thai version by using the translation and cross-cultural adaptation process and determine construct validity and reliability in Thai-speaking individuals. For the methods, the process of translation and cross-cultural adaptation of the IDFAI original version to Thai version, using the standard guideline of Sweden in 2000. After the Thai version was created, the first session we determined construct validity testing in 200 participants with a history of ankle sprain. By analyze correlation between the IDFAI Thai and the other questionnaire, includes the Modified Thai Lower Extremity Functional Scale, or LEFS, the Thai version of Visual Analog Scale for Instability, or VASI, and the Thai version of the Foot and Ankle Ability Measure, or FAAM. About the reliability was determined internal consistency and test-retest reliability in randomly select 100 participants with a history of ankle sprain. They complete the IDFAI Thai again after 7 days of the first session and comparing the score of the first and the second session. The result found the validity of IDFAI Thai has strong and significant correlation with the LEFS, VASI, and FAAM, as shown in the table, respectively. The IDFAI Thai demonstrated an excellent internal consistency and a good to excellent test-retest reliability as a convex alpha value at 0.983 and interclass correlation coefficient value at 0.885. About the ceiling and floor effects were not found. In conclusion, the IDFAI Thai is an excellent, reliable, and valid self-reported questionnaire. This questionnaire can be applied to identify chronic ankle instability status among the Thai-speaking individuals with history of lateral ankle sprain in both of clinic and research setting. That's all of my presentation. Thank you for your attention. If you have any question or suggestion of my study, you can contact me at email that shown in the slide. Thank you very much.
Hello everyone. My name is Rungdi Thapsila. I am a PhD student from Khon University, Thailand. Today I would like to present about inter-individual variability of gross motor development in Thai healthy full-term infants aged from birth to 14 months. Gross motor development are the ability of large muscle groups to produce whole body movements. Gross motor development of each infant is a dynamic process and not linear development. The dynamic system theory emphasizes that emergence and change in motor development does not only depend on the maturation of the central nervous system, but also on the interaction of multiple subsystems within a child, the environment, and the context surrounding. Delay development is commonly screening cross-sectionally, which could give a false positive result. Currently, longitudinal screening of gross motor development in healthy full-term infants rearing in the northeastern area of Thailand is still limited. Therefore, the objective of the study was to investigate the inter-individual variability in gross motor development of infants aged from birth to 14 months. Gross motor development of 41 full-term infants was longitudinally assessed every month from the age of 15 days until 14 months on the same plus or minus 5 days using the Alberta Infant Motor Scale or AIMS. The obtained scores were plotted on the gross motor development percentile curve established from a cross-sectional study in 571 Thai full-term infants. The result found that each infant showed no systematic pattern in percentile of gross motor development up to 13 months of age. The total mean length of gross motor percentile for all infants was 65.95. Percentile changes for individual infants over these 14 assessments was a minimum of 36 percentile points to a maximum of 93 percentile points. The first picture shows two examples of individual patterns, including the infant who had the most variability and the infant with the least variability. Moreover, the previous study of Dara et al. Reporting the cut-off point for the risk of delayed motor development of below the 10 percentile at age 4 months and below 5 percentile at age 9 months. According to these two cut-off points, two infants show percentile of gross motor development equal to or below the 10 percentile. However, no one had percentile below 5th percentile. The result was in line with that of Canadian healthy infants, which show a natural intervariability of healthy infants. Although two infants had gross motor percentile below the risk point once, we found that infants can walk independently before 14 months of age and had no delayed gross motor development. Infants who show little intervariability of gross motor development had their percentile of gross motor below the 50 percentile. In conclusion, development of gross motor in healthy full-term infants are non-systematic and fluctuates across longitudinal assessment. While infants had low gross motor percentile as cross-sectional assessment, they finally achieve typically developing gross motor development. That's all of my presentation. Thank you for your kind attention.
Hello everyone, my name is Chalmin Byon, a student of Department of Physical Therapy
Daegu Health College. I think it's a great honor for me to introduce this work named Effect of Treadmill Walking Training on the Balance and Walking Ability of Stroke Patients according to the tempo of song. Improving walking speed is an important goal for rehabilitation of hemiplegic patients. It was performed to determine if there's a difference in the effect on walking speed and gait ability when fast tempo sound is added during treadmill gait training of hemiplegic patients. Here comes the method. This study was performed on 30 patients diagnosed with stroke by magnetic resonance imaging or computed tomography. These patients were randomly assigned to 15 subjects with fast tempo song stimulation and the other 15 subjects with slow tempo song stimulation. This study was conducted at a hospital in Daegu City for 3 weeks from October 1st to October 31st, 2020. Training was performed 3 times a week for 20 minutes per session and was targeted to patients who voluntarily participated and agreed to all training courses. So, as a result, both the fast tempo and slow tempo training groups had no significant difference in Berg balance scale comparison before and after intervention. The results of this study show that the time and speed of gait in gait right are significantly increased after the fast tempo training as a result of intervention before and after each group's training. The treatment method using music may use a patient's cell phone or any device, mobile device, capable of playing music. This has the advantage that it can be easily applied not only in hospitals but also at home. Treadmill training through fast tempo music could potentially have a positive effect on recovery of walking ability of patients. In conclusion, the results of this study suggest that fast tempo treadmill training is a therapeutic intervention that can positively change the walking ability of stroke patients. Thank you for listening.
Hello, I'm Cheonjin Park from the Department of Occupational Therapy at Daegu Health University. From now on, we will start presenting the capstone design products. I wanted to make products that could be used right in the treatment room through the capstone design competition. Therefore, I thought about the inconvenience or improvements during the hospital practice, and after much discussion, I made this ice stick cover and storage box. First of all, the ice stick is a tool used to irritate the patient's mouth or skin during the intervention of the cold tactile stimulation method of patients with swallowing disorders. In hospital, ice sticks were usually kept frozen in disposable sanitary gloves, so we found 3 problems. First, because the length of the sanitary gloves is different for each finger, The shortest thumb is a hygiene problem, where the cover is not covered all the way. To solve this problem, we tailored the length and cover of the stick. Second, I thought that there are hygiene and safety problems because the sanitary gloves are tough and the thrown surface is not uniform when using ice stick individual. Therefore, it was made to be individual, used with one touch by inserting a seize using a dot knife. Lastly, I found it difficult to maintain the proper amount of moisture because the stick is kept standing or lying down and frozen. For this reason, we have made a dedicated storage box that can keep the moisture content by lining it on a 30-degree lamp. If our products are used in the treatment room, the therapist preparation time for treatment will be reduced, and it is expected that it will have a good effect on infection prevention management. Thank you for listening to my presentation. Thank you.
Hello, I am Soyeon Park, majoring in occupational therapy at Daegu Health College. I'm going to introduce capstone design called MLP. MLP stands for multi-laser pointer, and it is capstone design for use in working training. Working is a very important element of human activity, and it is the base of all activities such as living, working, and enjoy leisure activities. The environment in which patients have to live after discharge required a variety of functions, and the common rehabilitation, though there was a limit to indoor functional training. To compensate for this, it was made to help functional working training before going outdoors. We formed a team of 8 students and came up with ideas through brainstorming. We designed blueprints and we made prototypes with hardboard, lens, and laser pointer. We visited Gang Hospital with a prototype and received feedback to supplement the problem and made a prototype through a 3D printer. Our MLP can use inside or outside anywhere without any limit. So we have to make it more clearly using with an ocular lens made by concave and convex. Also, we make more comfortable to use fixed setup for easy to fix and using speaker for low vision patients. MLP can be easily and conveniently charged by using a C-type charger, not in a form of the battery like a conveniently laser pointer, and the remaining battery is displayed. For the simple use the therapist during the treatment, we made it similar to the size of the existing laser pointer, so that it can be counted in one hand. If you look at the expected effort of MLT, first, it is simple to use even in a small, foldable, small space. Second, a row and voice can be used to train the patient to make a turn right working. Third, it can also be used for patients with low vision through voice direction. Finally, rather than using only the therapist's auditory extraction, the patient concentration increased by using vision and auditory instruction together. Utilization plan of MLP. First, inpatient working training, leisure, and voice help guide the way changes the direction. Second, it can be used for step-by-step working training, as well as straight or cover working training, uphill and downhill load or stairs. Third, in addition to work training, it can be used for neglect patient. For example, matching the name of the object that the round point to. Fourth, it can also be used for sitting and standing balance training. Finally, it has a speaker function that can be used for treatment use voice instruction for patients with low vision. Some on-field therapists said, "We need something for working training, so we design and make multi-laser pointer." And my time is gone. Thank you for listening and goodbye.
colleagues and students. Welcome back and good to see you again. And I hope you had beneficial and rewarding time during the presentation sessions. Cross-border exchange is constantly gaining importance, even through online. Through collaboration, we can contribute to better international practice and also benefit from increased access to knowledge and technology. Such activity creates better cross-cultural understanding, improved contact between countries, the building of personal relationships, and professional connections. Since it was the first attempt to hold the online symposium, I'm sure we have caused you with some inconveniences. I ask for your understanding. However, of all, I think this first online symposium has been successful, thanks to all your participants. I anticipated about 100 participants, but actually, it turned out to be about 400 in total. All moderators and presenters showed up and ran the session smoothly with eager and sincerity. Now, there will be an announcement to select 5 outstanding student posters and presentations. 10 students from Daegu Health College and 8 students from Konkan University applied. And the competition was fierce. So we decided not to rank the order of award and just to give an equal award to only top 5 outstanding presentations. All right, here we go. I will announce it now. The first selected presentation goes to Jo Seul-gi and Lee Ye-bong, Nursing, Daegu Health College. The second selected one goes to Chebina Kim So-ye, Nursing, Daegu Health College too. Okay, next selected one goes to Sunanta Pramin, Physical Therapy, Konkan University. Okay. Congratulations. Since the students from Konkan University is away, not in Korea, the certificate and gifts will be mailed to your university. Next selected one goes to Noparas Sankarit Physical Therapy, Konkan University. Okay, now we have one last selected presentation, and it goes to Nichita Chongkwan Chana, Medical Science, Konkan University. Again, it was very difficult to select the top 5 presentations. So, as a token of appreciation, all student presenters will receive a certificate and a small gift anyway. Okay? So thank you very much. Now, the 5th Allied Health Sciences Symposium is waning, and the 6th one is rising, which will be held in October this year in Japan. I'm going to hand over a baton of the coordinator position to Dr. Sokatsu Yamamoto from Kumamoto Health and Science University, Japan. President Motohiro Takeya is going to welcome all of you through a pre-recorded video. So everyone, shall we watch together?
Good afternoon, everyone. It pleases me to see you today. I'm Dr. Sokatsu Yamamoto, Preparation Committee Chairperson for the upcoming 6th Allied Health Sciences International Symposium 2021 to be held in Japan this October. At this time, I would like to present a video featuring Dr. Motohiro Takeya, President of Kumamoto Health Science University. Dr. Takeya will introduce our school and outline the symposium. In addition, there will be a bit of video footage on our local sightseeing attractions in Kumamoto. Also, information about the symposium will be available on our school's website soon. So, please look for that. We are looking forward to seeing you all here in Kumamoto this autumn. Thank you.
Good afternoon, ladies and gentlemen. My name is Motohiro Takeya, President of Kumamoto Health Science University. It is a great honor for us to host the 6th Allied Health Science International Symposium 2021, which will be held this year on October 8th and 9th in Kumamoto City, Japan. The main theme of the symposium is education and research at healthcare universities in the new era, looking to the post-corona-19 world. As you are aware, COVID-19 is currently the most important global concern. The social impact of the COVID-19 pandemic is incalculable. It is threatening not only human health, but also the global economy. University education is no exception either. We need to set up control measures to avoid infections in routine education in classrooms, laboratories, and during practical training. In accordance with this main theme, we chose as the topic of the plenary symposium, higher education initiatives in the COVID-19 era. Each university is encouraged to present their endeavors in preventing coronavirus infections in routine education. Even in the era of COVID-19, we need to look at the post-corona period. It is expected that the healthcare universities continue to produce well-trained medical professionals. In this respect, not only presentations concerning COVID-19, but also those concerning fields other than COVID-19 are also welcome. Our university has a student body of about 1,500. We have 3 departments, namely the Department of Medical Technology, Department of Nursing, and Department of Rehabilitation. We also offer master course in the medical technology and rehabilitation. In addition, our university makes available 1-year midwifery course. It will be our pleasure to give you a tour of the campus if you can spare some time. Even in this kind of situation, international collaboration is still needed to exchange the newest information and current knowledge. Carefully watching the condition of coronavirus prevalence, we will plan the details of the coming symposium. It is my hope and belief that many of you will be able to attend the 6th symposium and have a chance to exchange ideas of the new world. I am looking forward to seeing you in Kumamoto. Thank you very much.
If you would like to see one of the world's largest volcanoes with your own eyes, you should visit Aso in Kumamoto. The vast caldera is surrounded by the outer rim of the crater, and the 5 mountains lined up in the center are known as the reclining Buddha. All of these mountains are known as Mount Aso. Unique Japanese ceremonies and festivals still take place in Aso. Affluent hot springs are located near the volcano. You can experience both the natural threat and its blessings. Japan is proud to present Aso as one of its premium tourist destinations. A full range of accommodation and restaurants are available. Don't forget to try a Japanese artistic full-course meal to enjoy the seasonable ingredients. Kumamoto Castle is one of the 3 finest castles in Japan. It is located in Kumamoto City, 1.5 hours away from Aso. You may be lucky enough to see a samurai or a ninja there. In Kumamoto City, everything from traditional Japanese arts and crafts to the latest cameras are available. A beautiful arch represented with stones and water. Elegant and unique Japanese dance. Crossing the 5 bridges across the sea to get to Amakusa. Wild dolphins are waiting for you. Christianity first arrived on this island in Japan. The Chinese culture has been rooted in Yatsushiro. Enjoy an unforgettable trip to Kumamoto and discover more about Japan.
Okay, thank you. I really wish that the pandemic disappears or we are all immune so that we could travel to Japan in October. Well, personally, I visited KHSU many times, and the people there are so kind, and the scenery of Kumamoto City and also the campus is really beautiful. I'm looking forward to visiting KHSU in October. All right. Now, on behalf of all participants, I'd like to invite Dr. Charito Pomido, Dean of Medical Technology from Central Escola University, Philippines, on Zoom to deliver a general review of the 5th Allied Health Sciences International Symposium. So, Dr. Pomido, can you hear me?
Yes, doctor, yes.
Yes. Hi, good to see you again.
Okay, can you see me?
Yes, yes. I'm very happy to see you.
Yeah, I miss you all. I miss you all. Okay.
Okay, I'd like to ask you for a general review.
Yes, I will. I prepared. Okay. Greetings to all. I was tasked by our esteemed organizer and colleague, Dr. Kim, to do the synthesis and final review of the proceedings of the symposium. How can I refuse the very esteemed and indefatigable Dr. Kim, my idol? He is the prime mover of this group, and without him, I think this group will not be in until now. We are on the 10th year of collaboration. Thank you, Dr. Kim, for this privilege. This is a unique experience to all. This remote or virtual symposium is very unique, but done properly, we were able to come together. We thank the Daegu Health College under the able leadership of President Sung Hee Nam for this occasion. And this is the occasion on the 50th or golden anniversary of the foundation of the very popular Daegu Health College. We extend our warm greetings and felicitations to Daegu Health College, now truly a world-class college. I am sure Daegu Health College will reach greater heights and manifest leadership in South Korea, not only in South Korea, but Asia and the Pacific region, and more so in the world. Dr. Peter Laurel, as AUAP president, gave us a heartwarming message to welcome everyone. Dr. Jung Zoo Park, a well-respected luminary in the field of nursing, expounded on the responses of South Korea to contain the COVID-19 pandemic. Not to be outdone is the world-class performance which entertained us, and we longed and wished for more of their performance. All of us would like to say, encore, encore, excellent performance. Thank you for that. The student poster presentation were well prepared. We appreciate their work. Truly, we pass on the legacy to this group of students, especially in the world of research. The empty session, chaired by Dr. Chaolin Park of Daegu Health College. For the information of everybody, we have close affinity to Dr. Chaolin Park because he is an alumnus of the University of the Philippines, having done his coursework in UP Diliman. He knows the Philippines and Diliman area by heart. And Dr. Chaolin Park, we could credit him for his work. He was the lead researcher on the MRSA project of Kumamoto Health Science University, Daegu Health College, and Centro Escolar University, where we published our research in 2014. We hope we can replicate same researches in the near future. All the 9 presentations in the MedTech session on the best practices in the practice, as well as the transformation to digital education are all noteworthy. We invite all to email the presenter because we were really short of time. Many would like to ask. No, thank you for that. As the nursing session chaired by Dr. Felicitas Sarmiento of FEU Nicanor Reyes Medical Foundation and Patbi Chesang of Konkan University were all very good. Surely, they all contributed to the advancement of the nursing profession in our region as well as the world. In the physical therapy, speech therapy, and occupational therapy session, we took note of the various presentations, which we are sure updated all of us on the trends of the 3 professions. The sessions were chaired ably by Dr. Yamimoto Sukatsu of Kumamoto Health Science University and Raymond M. Toso of FEU Nicanor Reyes Medical Foundation of the Philippines. We thank all the participants from the College of New Caledonia, Prince George in British Columbia. Okay, they did very well by joining us and informing us of the situation in the northern area, North America. We thank Konkan University for their contribution, not only in Thailand, but the Southeast Asia and the world. And of course, Kumamoto Health Science University, where their president, our own, invited us for the next or the 6th Allied Health Symposium to be held in Kumamoto, Japan. And we hope this will be not virtual, but physical, because we would like to enjoy the sights of Mount Aso and Kumamoto Castle. Very good place. We have to ride the train, the monorail there. Okay. And of course, the Far Eastern University under our president, Attorney Abad, okay? Okay, of course, our dean, Dr. Natividad, our colleagues in the nursing and other rehabilitation medicine professions. And not to be outdone, we have the Daegu Health College for hosting this fifth symposium, the first virtual ever. And of course, we thank also CEU, School of Nursing, and School of Medical Technology. And of course, we would like to send you the greetings of our administrator, Dr. Padulina also. And last but not the least, we have the Lyceum of the Philippines University, where Dr. Peter Laurel is the new AUAP president. We thank and join Daegu Health College for bringing us together amidst the COVID-19 pandemic. Surely the adage, if there's a will, there's a way, is again proven. All will come to fruition when there is hard work and persistence. Dr. Kim is the prime mover. The international officer of Daegu Health College is incomparable. He always worked with painstaking detail to bring out the best. Congratulations, Dr. Kim, Dr. Nam, and the whole Daegu Health College on your golden anniversary of your foundation. Thank you, everyone. We pray that in the 6th Allied Health Profession Symposium, it will be face-to-face. Until then, thank you and Godspeed. Thank you. That's all, Dr. Kim.
Thank you, Dr. Pomido. Thank you for such nice compliment, nice words, and insightful comments. She is a very close friend of mine, and I will miss you. Okay, that's all for the symposium.
I miss you all.
Yeah. All right.
Yes.
So this is the end of the closing session, and I'm going to close the symposium here. And I thank you all for your active participation. I hope to see you again at Kumamoto Health and Science University in Japan in October. I wish you all a safe, healthy, and prosperous 2021. Thank you all and take care. Bye-bye.